Dee Myers, you have a lot of expertise when it comes to helping people struggling with eating disorders. So I remember when I was in high school health class, this was in the early 2000s, I remember learning about bulimia and anorexia. And I'm sure it wasn't said to me at the time like this only affects females, but that's probably the impression that I got.
The statistic is 1 to 4 to 1 to 3 individuals with eating disorders are male. I was in private practice for 15 years before the Emily program came to Spokane, and then I came to Spokane, and I had a handful of male clients in my private practice over the years. The Emily program opened here in 2013, and it was a year before we had our first male client come through our doors and be a part of our programs here. And now we have males in or male identifying clients in our programs at all times. So we are seeing actually an increase in individuals in higher levels of care. In general, anorexia and bulimia and even binge eating disorder are thought to be more primarily female. And really, statistically speaking, they are. However, we are seeing higher percentages of males with anorexia or bulimia or binge eating disorder. As a matter of fact, binge eating disorder is the most common clinical eating disorder, period, for men or women or individuals in the LGBTQ community. And that's something that's not known because we hear more about anorexia and bulimia. Those are more sensationalized in the media. To add to that, there is the diagnosis of ARFID, which is avoidant restrictive feeding intake disorder. And that is a very common clinical eating disorder that is characterized by a person not meeting their nutritional needs, but it's not based on body image. So they don't think they're fat, they're not trying to lose weight. And ARFID is very common in boys and in males and male identifying clients. The identification and treatment of ARFID has really exploded in the last, I would say, even like 5 to 6 years.
What are the psychological drivers compelling someone not to eat enough of the nutrients that they need?
So there's three subtypes for ARFID. One is sensory issues where it may be taste, texture, temperature, smell, which is pretty common in the autism spectrum disorders. And then a second subtype is fear or trauma with food. So maybe somebody actually choked on something at some point. So then they become afraid of eating because they actually did choke, or they may have a fear of vomiting. So it's fear of aversive consequences to eating. And then the third seems to be just a genetic or general disinterest in food. So eating, nothing sounds good. Eating becomes a chore. Food doesn't really taste good like it does to the rest of us. And so it's very easy to forget to eat. So those are the three common subtypes, and they can overlap as well. So those individuals end up, especially over the time of adolescence, they don't meet their growth trajectories and they may be in some state of malnutrition.
So it sounds like it's not the case that every person with an eating disorder has unhealthy body image issues.
Correct. So the body image issues are a part of the diagnostic criteria for anorexia and bulimia, and they're common in binge eating disorder as well. So someone's self concept, self-worth is unduly influenced by their weight and their shape. But in the ARFID category, those individuals usually actually a lot of them have body image issues in the other way. They feel like they get comments about being too skinny, and they don't and they so a lot of them actually want to gain weight in treatment. Something that we see in males that is newer in the last like 20 years, maybe even in the last 10 years, is for some individuals who do have body image issues, it might be not so much of I want to lose weight, but for a lot of males, I want to be more lean, I want to be more muscular, I want to be bigger. And sometimes we see the eating disorder come in where they are attempting to lose fat and build muscle, but the eating disorder ends up manifesting in that because of the restricted intake. So they call it muscle oriented body dissatisfaction, where those individuals are focused on that. And then As you might see in your social media feed, protein, 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 right? You're supposed to have so much protein. Well, a lot of male clients feel like that's part of what they need to do. So they start restricting their eating, restricting their carbs, trying to eat as much protein. And sometimes it also comes through with eating clean. Clean eating is also common out in diet culture. And so when someone's clean eating becomes so extreme that they end up not meeting their nutritional needs, or they become obsessed with clean eating and very rigid in what they eat, then that's when the eating disorder manifests.
So you're helping both adults and minors or children?
Yeah, we see adolescents age 12 and up.
For the adolescents you're seeing, how often do you get the sense that the kid themselves decides they have a problem, knows they have a problem, and then asks their parents, hey, can we get some professional help for me? Versus the parents kind of force the help, the treatment onto their child.
I would say it is much leans much heavier toward someone else in their life discovering that they have a problem, or their primary care physician is seeing that they are not following their growth curve trajectory, or they've had a significant weight change in a certain period of time. And so mostly it is, I mean, this is a voluntary facility, but a lot of the adolescents don't want to be here and feel like they are being forced to be here by the people in their lives that care about them. Sometimes we see someone, an adolescent, who really knows that they have a problem and want to change that, do something about it, and often that is with ARFID, because individuals with ARFID are impacted socially as well. When it's very difficult to eat with your friends, go to a pizza party, stay at a sleepover. And so sometimes we do see that those individuals are motivated to expand the number and like variety of foods that they can eat so that it doesn't impact them as much socially.
What is binge eating or binge eating disorder?
Yes. Well, first I can define what binge eating is. So in the field, we operationally define it as eating a large amount of food in a discrete period of time that is more than someone would than average would eat. And it is usually accompanied by a feeling of a lack of control and then feelings of guilt and shame. So I always use the example at Thanksgiving. A lot of us overeat at Thanksgiving, but we didn't feel out of control and hopefully are not filled with guilt and shame. Hopefully we're even filled with pleasure of enjoying this meal. Whereas someone who is binging starts to eat something and then feels like they need to eat something else. And then sometimes a switch flips and they say, well, I've already blown it, so I might as well eat what I want. And they eat till they're really uncomfortably full. So then in bulimia, that would be followed by some sort of compensatory behavior. In binge eating disorder, the person does not have the compensatory behavior and usually really has a lot of guilt and shame over the amount of food that they ate. So it could be self-induced vomiting. It could be fasting for a period of time to compensate for the binge. It might be excessive exercising. It can also be diuretics or laxatives.
Would I be correct to assume that some of the time, part of the treatment or advice that professionals are giving to people with eating disorders is to restrict their social media use or get off of social media or something?
We give the advice and guidance to curate your social media feed. So unfollow unhelpful accounts and follow recovery oriented accounts. We do that in groups. Sometimes we have a whole list of accounts that are really recovery oriented that we might suggest. And we all know how easily an algorithm can be impacted by looking at one thing one time. Then your feed gets more and more of that. And so it takes energy, time and energy, and it takes some self-discipline to remove those things from your social media. A lot of our clients take a social media break and will literally log out of something like Instagram to make themselves take a break from seeing that stuff, and then hopefully are in a better place in their recovery that they can go back in and work on that curating, like I was mentioning. There are a lot of recovery-based influencers who share about their recovery journey, who share about rejecting diet culture. That's something that is pretty common in that space because, as you probably know, diet culture is back bigger than ever. We are back to like the mid 2000s when extreme thinness was really in, and diet culture. I mean, we always have diet culture, but it's stronger than ever right now.
Are there some influencer social media types who focus on the male population and their recovery from eating disorders?
Yes. Yeah, and I can provide you with some links that you can post for your listeners. There are definitely some who are it's really inspiring because maybe their bodies have changed quite a bit in recovery, so their bodies don't match that perfect male body anymore. And it is pretty sad to see the negative comments that individuals get in being brave and posting about their recovery life, but that it is really inspiring to watch them do that. And so, yeah, there are definitely some male focused influencers.
Are there programs in high schools in Washington State that are focused on like healthy eating, that kind of thing?
I can't answer that specifically, but I do know that there are still questionable content that is in health classes. Sometimes we see the development of an eating disorder after a client was in health class and they were asked to track their calories for a period of time, or they were taught how many grams of fat are in peanut butter. And so then they villainize peanut butter, and now I can't eat peanut butter. And maybe they might learn about eating disorders in a very short blip in that chapter of health.
Interesting. Okay. I guess what I was thinking of is I know that, for example, for suicide prevention, there are clubs in high schools that focus on that, and I wondered if there was anything that was specifically eating disorder branded that was like clubs
For
or an
for
organization
recovery.
that maybe delivers, a guest presentation. They go from school to school giving presentations or something.
Yeah, I mean, sometimes they have speakers like myself come into high schools or middle schools and talk about eating disorders and the dangers of eating disorders. But you got me there, Blair, because you said, are there programs that focus on healthy eating? And healthy eating is a term that can be very manipulated these days. And in diet culture standards, healthy eating is going to look very different than what we are going to be focusing on in higher levels of care for or just eating disorder treatment in general. We're going to be focusing on balance, variety, and moderation. And the Emily program has an all foods fit philosophy. So we take the moral value out of food. You're not good if you eat the carrot, and you're not bad if you eat the carrot cake. And so we're promoting balance, variety, and moderation. And there's a lot of Instagram accounts right now who are really into the healthy eating in a way that actually promotes disordered eating.
So let's picture a male client, and can you give some typical examples, maybe specify one eating disorder or just multiple eating disorders, but the kind of advice and guidance you'd give them, and then maybe how long on average their treatment would last.
Boy, that's really a hard question to answer because every individual that comes into treatment is at a different place in their eating disorder. And something that we are seeing now in eating disorder treatment in general is people are waiting longer and longer to get care. So when individuals come, by the time they get to us in higher levels of care, they're pretty sick. They're pretty entrenched in their eating disorder. So it just really depends on someone's access to care, someone's support system, how long they've had their eating disorder. We are working first and foremost to nutritionally rehabilitate someone. So we want to make sure that they are getting the nourishment that they need to feed their brain and their body so that we can do the rest of eating disorder recovery work. And it really just depends on someone's ability and willingness to increase the amount of food that they're eating, or increase the variety of food that they're eating, or work on curbing those binge and or purge behaviors after program. Someone's journey might be 6 weeks, someone's journey might be 3 months. in treatment, and we are kind of working through a progression of initially that nutritional rehabilitation and medical stabilization, and then working on development of coping skills, and then working on what are the factors that are maintaining your eating disorder and what are the factors that are underlying your eating disorder. And I really want to make sure that I mention that eating disorders are definitely more common in the LGBTQIA plus community. Statistics show that the percentage is higher, the risk is higher, and there's so many issues that contribute to that, with stigma, with discrimination, with barriers, with lack of support system. For trans individuals, the gender dysphoria definitely interacts with the eating disorder pieces. And so someone might be trying to reduce sex characteristics like breasts or curves, and someone else might be just so disconnected with their body that they don't want to they don't know how to fuel and take care of their body because they're so disconnected to it, or they feel so negatively about it. We are providing affirming care. We are providing supportive care. This is a super accepting and diverse company. And I love that about the Emily program. And so all of those pieces together go into what that treatment journey is going to look like for someone. In the gay population, sometimes there are more appearance pressures, and to have that lean body type and to be attractive and to look a certain way. So, and there's high body comparisons sometimes in the gay community. So we see that sometimes. And then I think just especially in the trans community, the discrimination, the stigma, the minority stress, all of those things really contribute to the psychological and emotional struggles that someone has that may be channeled through into their eating disorder as a way to cope with all of that.
Are there any male celebrities, famous people who are known to have had an eating disorder?
Earlier this week, we watched the Noah Kahn documentary on Netflix, and he is a singer-songwriter, and he talks openly about having disordered eating and body image issues throughout that documentary. And when I was watching it, I didn't know that that was part of it. And I was very excited to see that, to have someone. And then he ends up talking a lot about mental health issues in general. There are some professional athletes that, having retired from the sport, have talked openly about having had an eating disorder while they were in the sport, or the difficulties of their bodies changing after they came out of the sport and were doing all of that training. And some of them are advocates, and speak out about it. So that is something that's really nice to see for the male community.
How often are people self-paying versus having insurance help them pay for treatment for eating disorders?
Self-pay is pretty rare. It's pretty rare to pay for a higher level of care. Some individuals are able to pay for just straight outpatient therapy on their own, or maybe pay for a therapist and dietitian, but even that is cost prohibitive for most people. So most people are accessing their insurance, and the Washington Medicaid programs have pretty decent coverage for eating disorder treatment.
Are you aware of any discrimination based on sex where any males have struggled to get their insurance to pay for treatment?
Not, I'm not aware of that. I will tell you, in my career, I have seen insurance coverage increase dramatically from when I was a younger therapist in the outpatient world and trying to send clients to residential. I had parents that had to refinance their homes to send their child away to residential. And that's pretty rare these days. Most insurance companies do pay for higher levels of care.
So for those of us that are concerned, let's say about boys and young men, the influences on them, what are the messages that folks like you who want people to have positive relationship with eating are delivering to them?
I have a little thing that kind of a little summary statement that I
Oh,
wanted to
yeah,
write,
perfect.
that I wanted to read. The biggest misconception about eating disorders in boys and men is that they are rare. They are not rare. What is rare is recognizing them early. Whether someone is a straight teenage athlete, a middle-aged father, a gay man, or a transmasculine young adult, eating disorders can affect anyone. The earlier we recognize the signs and reduce the stigma, the better the chances for recovery.
Thank you.
You're welcome.
Okay. Well, cool. It's been really a pleasure talking to you and being educated better on this. And I'm very, very happy to have this opportunity to cover this subject. I'm sure I'll now be better prepared when I have conversations with people in the course of my outreach and advocacy to connect with them on this topic.
Yeah, thank you. Thank you for your willingness to learn and to advocate for the male and male identifying population because it is there are, specific and different needs in the subset.